Well, this week on our briefing, I'm joined by Quayle, Minister for Health and Social Security. You want to spend £3.2 million on a computer system for the hospital that's replacing one that's only 7 years old. I mean, a lot of people, I know things move fast, but 7 years to have a system that's now basically redundant, and you need to spend that sort of money. Why?
Well, because the original system was only had a life expectancy of 5 years. The life goes on all the time with these systems, and it had a life expectancy of 5 years. That was when we signed up for it, so that's what everyone knew at the time when they went into it. 5 years, plus you could extend it for 2 years. Now we're 6 years into it. We are the last health organisation to have this upgrade, and the significant benefits of it. This new upgrade is so advanced that even the British Army use it in Camp Bastion in Afghanistan. I
put it to you, we'll watch this back in 5 years and it'll be redundant again.
It will be, because a new system will be. You know, you buy a computer for your home or an iPad. 5 years time, the old one's got to be binned, and you need a new one. So technology moves on all the time. So, but let's put it 3.2 million. There's no point beating about the bush. It's a shed load of money. However, when you put it into context with the spend of the department and the criticisms I've made, we spend 240 million gross a year in this department. So let's say this programme is 5 years life expectancy. £1 billion will have been spent. Now, at the moment, I've well known for criticising the department for not benchmarking, keeping data. I said there was a desert. And
they blamed this computer, didn't they, saying it didn't do what you wanted it to do?
Well, that was some of the areas, that was one of the areas they blamed. And yes, this new system, along with other IT systems that I'm putting in place, will allow us to do more benchmarking, more data recording. Also, I'm working towards, I want to take the health service especially, and social care too, as paperless as possible. At the moment, we pay 18.8 people to do medical records around Noble's Hospital. They either go in a trolley to be pushed around. So if they, the amount they've got, they're bound to misplace the odd one from time to time. Yeah. So you've waited for a few months to go and see a consultant. You turn up and they haven't got your record. Your appointment's cancelled. I want a system where you go to see your doctor, your consultant, and they can just tap on the screen, and there's Mr. Moulton's medical records there, paperless, far more efficient. So not only will, and when you go around the hospital, instead of having records to take round, there'll be little stations where you can just wheel it or a tablet to a person by the side of the bed, go through everything with them. It's all in front of them. And then when you come out of hospital, I want a seamless transition. So a doctor, if you've come out of hospital and you've been given a load of drugs to take, the doctor, your own GP, will be able to go on, see what you've been given, and plan your treatment accordingly. At the moment, I think that the nurses have got to scan the document, paper scan to the doctors, who've got to print it off, and then they've got to scan it onto their computer records.
Is this the system that everyone else is on? I mean, in the UK, is this the one that...
It's not, there's various systems. This is one where a significant number, and as I say, if the British Army think it's good enough for them, then we think we've got it right. What do we do if we didn't go for this upgrade? It's totally obsolete, So we either go for a new system, but if we go for a new system, we were looking at a £6 to £9 million spend, which makes 3.2 million look cheap. We'd also then, all our staff and my colleagues in the health service especially, are used to the Medway system. So whilst this is likely a brand new system, they are used to the basics of how Medway works. So therefore, and an awful lot of the cost isn't the IT system, it's the 55 weeks of implementing this new system, to train everyone up, to get all the procedures in place, to alter the data, to process the additional data. So
did you put this to tender then, or did you just go for this one system?
You couldn't go for tender because this was an upgrade. If there had been another system that was a similar that we could have got for a similar price, then yes, you could have gone out for tender. But a new system, as I said, would have been £6 to £9 million. This is an upgrade, but a major upgrade.
Which means in future, Tynwald's House of Keys, and someone says how many operations have been done, how much did it cost, will that information then be available?
This will go part of the way towards...
Part of the way?
Yes, well, there's all sorts of data patient cost programmes that I'm going to put in place. So I hope, I can't wave my magic wand, Paul. We're not going to turn the health service and social care service around in 3 months. It's going to take me a couple of years to get everything, because you can only analyse data once you've done it for 12 months. So, but this will put us on the right road to going where we need to be. We are spending $1 billion every 5 years in this department, and therefore having a state-of-the-art IT system that allows us to benchmark, show our costs, do proper data recording so we can see how we're comparing, where we need to improve, where we're doing a good job, where we need to get a better value for money. It will pay for itself in the coming years.
And when will it be up and running?
Subject to Tynwald approval in June, we will start it straight away.